Hey, I'm back. Yeah, so here's a good one. I connected some dots here as a result of going back into this and really taking another look at it. Every time I go back into it, I see more and more and more, and it's revolting. So anyway, I figured this out. Jennifer Baxter reached out to Douglas James. Is that his name? Joshua Douglas. James Joshua Douglas. Infectious disease. And not in this video, in another video, I'm going to talk to you about my meet with him and exactly what came down when he examined me, or lack of. It was ridiculous. I'm pretty sure that guy wanted to go golfing, but that's another video. So I'll stop there. So anyway, it was mentioned that I was set up or had an appointment to get a colonoscopy, which I ended up getting. But here we go. Check this out. This is between Jennifer Baxter and the James Douglas, whatever the fuck his name is. Okay, and then that Dr. Effis Chesson, he is the doctor that did the colonoscopy. Okay, it says, I spoke with Leslie today, Dr. Baxter. This is obviously from James Joshua Douglas. Again, we have not found any evidence of ongoing parasitic disease. Multiple repeat stool O&P have been negative for intestinal disease and serology negative for extraintestinal. Still having LLQ, ABD pain, and stools that are soft with tissue pieces. I have referred her to Dr. Effis Chesson for colonoscopy. I will also refer her on to Dr. David Harris, who is an ID doc who does have an interest in delusional parasitic. So it started with Jenny, and after the examination I got from this character, which was, you know what, I can't wait to talk about that. That happened in Seashell, by the way. Okay, so let's go on to the colonoscopy. Yeah. But before the colonoscopy, let's talk, or let's have a little more conversation between Baxter and Douglas. Okay? So yeah, the date on that, November 4th, 2020. I spoke with Leslie via telehealth today. She was very animated and combative on the telephone, saying physicians don't care. Facial rash unchanged with the hydrocortisone, but no evidence of MRSA associated bullous impetigo at the physical 2 weeks ago. Still having LLQ abdominal pain with pruritus and irregular stools. No appetite or energy. Repeat stool culture for Ehrlichiosis negative. She is requesting a stool test for Dipylidium canine, the dog tapeworm. However, we would have seen the ova in her stools on prior O&P. I did send her another requisition for high-risk O&P, however low yield. I feel she should be referred for a colonoscopy and will send the referral to Dr. Effis Chesson. If the stool O&P is negative, I will follow up after the colonoscopy. If the colonoscopy is negative, we may have to consider psychiatry referral for delusional parasitosis. Okay, fair enough. So, I get my colonoscopy, and guess what? Guess what? Note this word right here too, please. Okay? I never had that. He just pulled it out of the hat. But I never had that. I know I did not have Aeromonas. Okay? Look up Aeromonas. It's almost like getting salmonella. This was probably from the Parasite, never mind. So CT scan of the abdomen was done, and while it was not possible to fully assess the large bowel in the lower left quadrant, where I've been telling them I've had pain for years and years and years, since it started. So since they couldn't see it, never mind. Ignore it. Don't address it. Moving on. Yeah. And I just keep going. It never ends. It never ends. This is between myself and Jennifer Baxter, and who else now? Who else is this? Thinks she has worms. Feels like she has crawling sensations in her face and back. Recent treatment for impetigo. Skin swab shows RS. Denies prior psychiatric issues. Not suicidal. What? So, I just want to talk about when Jennifer Baxter did allude to a disorder, a mental disorder. I remember how she approached it. And I being in my state of sadness and not really, you see, when you're in that state, you're not really mindful or as acutely aware as when you're doing okay in life, and you know what's going on, and you're in the know, and you can feel things and figure them out. When you're at a loss, you're detached from that. You don't have the energy for that. You only have the energy to self-heal. So when we had this conversation, I remember snapping out of my sadness and being like, no, Jenny, no, Jenny, you got this wrong, Jenny. No, you don't need to go there. This movement I feel in between my eyes, up and down my nose, fluttering in my back, deep pain, my left side quadrant, the burning in my head, the stiffness in my neck, I can feel it going down my throat. Private areas, very afflicted. I'll spare you the details, the horrible, fucking, traumatic, tormentive details. I remember Jenny saying to you, nip that shit. You're way off base. I did not expect you, Jennifer Baxter, to float it around on my record or send me around like I were a fucking guinea pig under this pretense. I actually entrusted my life with you, Jennifer Baxter, that you would send me to the right people to help rid myself of this. Now, Now you're all going to say, anybody can say, well, just because that was then doesn't prove that that's why doctors are still, treating me the same way now. Well, that might be the case. That might be the case, but you know what? On my next video, I'm going to tell you about my visit to a psychiatrist in Vancouver's downtown east side. Yeah, he's been around there for a while. helping all the impoverished, mentally ill. My next video, I'm going to tell you how I came into meeting this character and what he suggested for me at this point 10 years later, and having this still infecting me, and all the discrimination and bullying I have endured for the last 10 years. I'm gonna share with you his suggestion for me. And then I'm gonna ask you, how can you deny that all this fucking shit hasn't followed me, hasn't red flagged me? Almost 10 years. Denied an MRI. And I assure you, this is in my fucking head. I don't know if it's between my skin and my skull, or if it's in my head. I know it's up in my sinuses, so fucking chances are. I know it's affected my sight. In the last 2 years, I can't fucking see without these. Blurry. The last 2 years, my eyes have become so fucking bad. Oh, but they're mucus strings. Why, doctor? Why? Age. All right, next video. Stay blessed. Jesus is King.